laryngotrachea bronchitis. The infection leads to swelling inside the trachea, which interferes with normal breathing, and produces the classic symptom of barking cough. What causes croup? Parainfluenza, influenza A. What is the hallmark sign of croup? Barking cough. What is asthma? Chronic inflammatory disorder of the airways. Inflammation results in hyperresponsiveness of airways, can lead to total obstruction of airways. What are the four phases of asthma? Mild intermittent asthma, mild persistent asthma, moderate persistent asthma, severe persistent asthma. What are some causes of asthma? Allergy, bronchial constriction, hypoventilation, tachypnea. What does dyspnea mean? Subjective sensation of difficulty or uncomfortable breathing. What does orthopnea mean? Difficulty breathing lying down. What does paroxysmal nocturnal dyspnea mean? Paroxysms of difficulty to breath at night, during sleep. What does Cheyne-Stokes respirations mean? Irregular breathing, with long pauses up to 60 seconds. What does Kussmaul's respirations mean? Increased rate and depth of breathing over a prolonged period of time. In response to metabolic acidosis, the body's attempt to blow off CO2 to buffer a fixed acid such as ketones. What does Bear's respirations mean? Short episodes of rapid, deep inspirations followed by 10 to 30-second apnea period. What are the pharmacodynamics of aspirin? Inhibits the formation of thromboxane A2, which is a potent platelet aggregate and vasoconstrictor. What are the pharmacodynamics of dimenhydrinate? H1 receptor antagonist, depresses hyperstimulated labyrinthine function, may block synapses in the vomiting center. What are the pharmacodynamics of diphenhydramine? Antihistamine with anticholinergic and sedative side effects. Antihistamines appear to compete with histamine for cell receptor sites on effector cells. What are the pharmacodynamics for naloxone? Reverses the effects of opioids including respiratory depression, sedation, and hypotension, antagonizes the opioid effects by competing for the same receptor sites, especially the opioid mu receptor, also shown to all three opioid receptors. What are the pharmacodynamics for nitroglycerin? What are the pharmacodynamics for salbutamol? Selective B2 stimulation, greater than bronchodilation and some degree of vasodilation, some B1 effect, especially with repeated doses, little or no receptor stimulation. What does Beck's triad indicate? Cardiac tamponade. What makes up Beck's triad? Low blood pressure, jugular vein distension, muffled heart sounds. What does Cushing's triad indicate? Indicates that brainstem herniation is imminent. What makes up Cushing's triad? Irregular breathing, widening blood pressure, bradycardia. What causes the Bessel-Gerish reflex? Right inferior infarctions. What makes up Bessel-Gerish reflex? hypotension, bradycardia, apnea. What makes up Samter's triad? Asthma, sinus inflammation with recurring nasal polyps, aspirin sensitivity. What is caused by Samter's triad? Aspirin exacerbated respiratory disease. What cc would you set the suctioning for an infant? 100 to 150 cc. What cc would you set the suctioning for in pediatric? 200 to 250 cc. What cc would you set the suctioning for an adult? 500 to 550 cc. Define hypoxic drive. What is pursed lip breathing? A breathing technique designed to make your breaths more effective by making them slower and more intentional. You do this after inhaling by puckering your lips and exhaling through them slowly and deliberately, often to a count. What does 1 on the pH scale mean? Very acidic. What does 14 on the pH scale mean? Very alkalotic. What is the renin-angiotensin system? A hormone system that regulates blood pressure in fluid and electrolyte balance. What happens in the renin-angiotensin system when renal blood flow is reduced? The juxtaglomerular cells in the kidneys convert the precursor prorenin into renin and secrete it directly into circulation. What happens after prorenin is converted into renin and secreted into circulation? Plasma renin then carries out the conversion of angiotensinogen, released by the liver, to angiotensin I. Angiotensin I is subsequently converted to angiotensin II by the angiotensin-converting enzyme found on the surface of vascular endothelial cells, predominantly those of the lungs. What does angiotensin II do in the body? Potent vasoconstrictive peptide, stimulates secretion of hormone aldosterone from adrenal cortex, causes renal tubules to increase in reabsorption of sodium and water into the blood while also excreting potassium. What are the general mechanisms of actions for sympathomimetic drugs? Heart, the adrenergic receptors, increased heart rate, increased contractile force, increased automaticity. Systemic, adrenergic receptors, vasoconstriction. B adrenergic, vasodilation. Lungs, adrenergic receptors, mild bronchoconstriction. B adrenergic receptors, bronchodilation. What are some examples of sympathomimetic drugs? Epinephrine, albuterol, dopamine, norepinephrine, isoproterenol. What is the general actions for sympathetic blockers? Class of drugs that antagonize adrenergic receptor sites, reduces heart rate, reduces contractile force, lowers blood pressure. What is the general mechanism of action for antidysrhythmics? Useful in treatment and prevention of cardiac dysrhythmias by either slowing or speeding up the heart. What is the general mechanism of action for parasympathetics? Drugs that inhibit the actions of parasympathetic nervous system. Also known as anticholinergic stimulation, induces peristalsis and causes pupillary constriction and a decrease in heart rate. What is the general mechanism of action for anticoagulants? Drugs that inhibit blood clot formation, used for acute coronary syndrome, acute embolic and thrombotic strokes, pulmonary embolism and deep venous thrombosis. What is the general mechanism of action of fibrinolytics? Drugs used to dissolve a blood clot. 3 main types: streptokinase, anisplase, alteplase. What is the general mechanism of actions for alkalizing agents? Used to buffer the acids present in the body during and after cardiac arrest. What is the general mechanism of actions for cardiac pain management? Drugs that have proved effective in alleviating pain, block the cyclooxygenase enzymes and reduce prostaglandins throughout the body. As a consequence, ongoing inflammation, pain, and fever are reduced. What is the general mechanism of actions for diuretics? Increases cardiac output, and to reduce pulmonary and peripheral edema. They act by diminishing sodium reabsorption at different sites in the nephron, thereby increasing urinary sodium and water losses. What are the general mechanism of actions for antianginal agents? Reduces cardiac output and perfusion of ischemic myocardium equal reduction and alleviation of chest pain. What are some examples of phosphodiesterase inhibitors? Viagra, Cialis, sildenafil, vardenafil, tadalafil. What do corticosteroids do? Both kinds. Corticosteroids are classified as either glucocorticoids, anti-inflammatory which suppress inflammation and immunity and assist in the breakdown of fats, carbohydrates, and proteins, or as mineralocorticoids, salt-retaining that regulate the balance of salt and water in the body. What class of drug corresponds with the suffixes azone, olone or onide? Corticosteroid. What are some examples of corticosteroids? Betamethasone, dexamethasone, defloresone, fluticasone, mimetasone, hydrocortisone, loteprednol, prednisone, prednisolone. What is the general mechanism of action for barbiturates? They cause central nervous system depression. This is brought about by stimulating the inhibitory neurotransmitter system in the brain called the gamma-aminobutyric acid system. What class of drug corresponds with the suffix butyl? Barbiturates equal sedatives. What are some examples of barbiturates? Butabarbital, phenobarbital, secobarbital. What class of drug corresponds with the suffix cane? Local anesthetics. What are some examples of local anesthetics? Lidocaine, prilocaine, proparacaine, bupivacaine, mepivacaine. What class of drug corresponds with the suffix -cilin? Penicillin antibiotic. What are some examples of penicillin antibiotics? Amoxicillin, ampicillin, oxacillin, nefcillin, dicloxacillin. What is the general mechanism of action for calcium channel blockers? What class of drug corresponds with the suffix diapine? Calcium channel blockers. What class of drug corresponds with the prefixes cort or pert? Corticosteroids. What are some examples of calcium channel blockers? Amlodipine, felodipine, nifedipine, nimodipine. What class of drug corresponds with the suffix eprazole? Proton pump inhibitors. What are some examples of proton pump inhibitors? Omeprazole, esomeprazole, raprazole. What is the general mechanism of action for non-steroidal anti-inflammatory drugs? Inhibition of the enzymes that synthesize prostaglandins. Prostaglandins cause inflammation, pain, and fever as part of the healing process. What class of drug corresponds with the suffix phenolic or profen? Non-steroidal anti-inflammatory drug. What are some examples of non-steroidal anti-inflammatory drugs? Bromfenac, diclofenac, ibuprofen, ketoprofen. What class of drug corresponds with the suffix iramine? Antihistamine. What is the general mechanism of action for antihistamines? Competitive antagonism of histamine binding to cellular receptors, which are present on nerve endings, smooth muscles, and glandular cells. What are some examples of antihistamines? Brompheniramine, chlorpheniramine, pheniramine. What is the general mechanism of action for beta blockers? Heart beats more slowed and with less force, thereby reducing blood pressure. Beta blockers also help blood vessels open up to improve blood flow. What class of drug corresponds with the suffix allyl? Beta blocker. What are some examples of beta blockers? Metoprolol, propranolol, pundolol, timolol. What is the general mechanism of action for ACE inhibitors? Medications that slow the activity of the enzyme ACE, which decreases the production of angiotensin II. As a result, blood vessels enlarge or dilate, and blood pressure is reduced. What class of drug corresponds with the suffix pril? ACE inhibitors. What are some examples of ACE inhibitors? Ramipril, lisinopril, benazepril, captopril. What is the general mechanism of action for loop diuretics? Act on the Na plus K plus 2 centiliter porter in the thick ascending limb of the loop of henol to inhibit sodium, chloride, and potassium reabsorption. This is achieved by competing for the Cl binding site. What class of drug corresponds with the suffix amide? Loop diuretics. What are some examples of loop diuretics? Furosemide, torsemide. What class of drug corresponds with the suffix zolam or zepam? Clonazepam, diazepam, lorazepam, midazolam, alprazolam. What is the general mechanism of action for benzodiazepines? Enhance the effect of the neurotransmitter gamma-aminobutyric acid at the GABA receptor, resulting in sedative, hypnotic, anxiolytic, anticonvulsant, and muscle relaxant properties. What is the general mechanism of action for nitrates? Relaxes blood vessels and increases the supply of blood and oxygen to the heart while reducing its workload. What is the general mechanism of action for digitalis? Increases the force of the heart's contractions, which can be beneficial in heart failure and for irregular heartbeats. According to the size of red blood cell, anemia could be hyperchromic? False. It is either microcytic, macrocytic or normocytic. What are the different possibilities arising from urinary tract obstruction? hydroureter and hydronephrosis. The kidney stones develop because of crystallization or aggregation of urinary salts when they are in too low concentration. False. It is exaggerated concentration, formed by the supersaturation of two or more salts. Regarding the hemoglobin content of red blood cells, anemia could be normochromic or hyperchromic. Erythrocytes in different sizes is called anisocytosis. Different sizes and shapes of red blood cells are called what? Poikilocytosis. Physiologic manifestations of anemia include what? Dizziness, fainting, pale skin, fatigue, eventual dyspnea. Anemia is defined as lack of adequate oxygen carrying capacity of blood. True. What is the material kidney stones are made from? Calcium, uric acid, struvite stones equal more prevalent in females due to higher risk of UTI. What is acute cystitis? Acute bacterial infection of the bladder. What happens when a pregnant lady doesn't have the proper amount of folic acid? Proper development of RNA and DNA causing abnormalities of the central nervous system mostly at the spinal level in form of spinal bifida. The spinal cord is present out of the vertebral column, and is referred to as a meningomyelocele. Escherichia coli is the most common pathogen in urinary tract infections? True. Cytopenic anemia is the most common cause of anemia worldwide? True. Cytopenic, ferropenic and iron deficiency are all synonyms, and iron deficiency is the most common anemia worldwide. Where do you find normocytic normchromic anemias? Shortly after hemorrhage. What are the three pathognomonic findings in glomerular diseases? Hypertension, edema, elevated blood urine nitrogen. What is the most frequent cause of end-stage renal failure? Glomerulonephritis. What is the threshold for diagnostic of nephrotic syndrome? Greater than 3.5 grams of protein per day. What is the pathognomonic finding in aplastic anemia? Pancytopenia. What is the visible sign of marked hemolytic anemia? Jaundice. Give an example of hemolytic anemia of autoimmune origin. Autoimmune hemolytic anemia, as well as purpura. X. Thrombocytopenic purpura. Why will cardiac failure be the origin of thrombocytopenia? Because the flow of blood is slower, there is a longer duration of the platelets in the spleen, leading to increased breakdown of platelets, and hence thrombocytopenia. The etiology classification of renal failure is what? pre-renal, intrarenal and post-renal renal failure. In chronic renal failure, there is reduction in creatinine and urea clearance. True. What is the name of a leukemia bases on immature red blood cells? Erythroblastic leukemia or myelocytic leukemia. Neutrophilia indicates chronic viral infection. False. What is the difference between acute chronic leukemias? In acute leukemias all cells are immature, in chronic leukemias cells are much more mature. What is the normal count of thrombocytes? 150,000 to 400,000 per milliliter. What is the name of the functional unit of the liver? Hepatic lobules. What are the hormones that reduces the motility of the stomach towards the duodenum during digestion? Gastric inhibitory peptide. What is the name of the nervous innervation of the digestive tract? Mesenteric plexus. What is the abnormal anatomical situation of the megacolon? Absence of ganglion. What is the name of the excessive vomiting during pregnancy? Hyperemesis gravidarum or gravidic hyperemesis. When kids do not develop sexually at the proper age, what is it called? Delayed puberty. What is the name of painful menstruation associated with high prostaglandin production? Primary dysmenorrhea. What is the name of the infection of the balanipucial sulcus? Balanipostitis. What is the name of the secretion that favors the development of papillomavirus on the prepucial surface? Smegma. What is the name of the pain of the breast? Mastodynia. Upon examination of a lady with salpingitis, endometritis, oophoitis etc., what does she have? Pelvic inflammatory disease. What is the name of the inability to retract the prepuce? Phimosis. What part of the genital apparatus is affected if you have blepharitis? None. Blepharitis is the inflammation of the eyelid. What is the most frequent cause of pelvic inflammatory diseases? Sexually transmitted infections. What is the name of the varicoses of the spermatic cord? Varicecle. What is the result of fibrosis of the corpora cavernosa? Peyronie's disease. What is the name of the condition in which the testicle hasn't descended into the scrotum? Cryptorchidism. What is the name of the inflammation of the testicles? Orchitis. What is the name of the inflammation of the prepucium?